All right. Well, hi, everyone. Thanks for having me. And as Julianne gave me a lovely introduction, so I'm going to talk to you about the cobots that we have at Christiana Care. And just to show, this is its name, and pronouns can be anything you want it to be. I give her feminine pronouns, but this is Moxie. So we have triplets. So we have 3 of them there. And the arm right here, it is for opening up doors, automatic doors. So right here, it has a badge, and then it's kind of its fingers can open up or push plates, and then it has drawers right here, where usually this is the biggest drawer. Equipment goes in, and it has 2 drawers in the back. So these are our Moxies, and I'm going to talk more about the program. Like, I do have a slide on the research, but just to go over kind of, because this is quite a big robotics program that we are working on here. There we go. So this all kicked off. Initially, we got the cobots in from donor money, and one of our donors wanted to help nurses. And then this big grant came along to reimagine nursing. And so the American Nurses Foundation had $14 million, and it was going to fund 10 bold projects, and it had 3 categories. And we applied for the technology-enabled nursing practice, and we were awarded $1.5 million over 3 years. And it was really to develop, test, and build and scale robotics. And just because this is a research crowd, I do like to put how many submissions were in there. This is 347, and they only funded 10. So we had a 3% pay line, which is really competitive, and actually more competitive than the NIH. So we're very proud to have, be able to be awarded this grant. So just a little bit about the Moxies and some of the work that they're doing. So we've had them since April. So they've been with us for almost 2 years now, and they're only at the Newark campus because Christiana has multiple hospitals. So they're only at Newark. And so far they have done over 32,000 deliveries. They have worked over 19,000 hours, and they travel all over the hospital, and they travel more than 5,400 miles. And then when we look at our ascending units, because these Moxies, they're a delivery system, and instead of a human doing the delivery or running around, we have the Moxies for that. And so our sending units are mostly pharmacy. They're the biggest bulk because they send a lot of medications that cannot go into our tube system, and followed by equipment room. So if there's equipment that can fit into her drawer, because she doesn't have like a little wagon or anything behind her, so it has to be able to fit into the drawer. And surprisingly, radiology, a lot of CT or CDs for CTs go around as well. And then our receiving units, Moxie goes all over. So at this point, I think it's like 82 units that she makes deliveries to. And then use cases are really important because we have Moxie. We're trying to do, some of that human work that humans should not be doing. And, like with pharmacy techs are the ones who normally do these deliveries, and really they shouldn't be out, running around when they can, be in the pharmacy, and they can be, filling prescriptions and answering phone calls and really taking care of that work that, they need to be doing. And so we're always with that mindset of, does someone really need to be doing this work? Can we offload it to a robot and have humans, reallocate to do work they should be doing? And so we're always looking at these use cases. And what our current ones are the, as I mentioned, non-tubable medications that go around. So if you're not familiar with the healthcare system, or haven't been really, been fortunate not to really be in a hospital that often, we have this. It looks like a capsule or a missile that kind of go all around the hospital system, and you can deliver, medication, small supplies in this capsule. But some things just can't be tubed; they can be agitated, and so like a person has to do that running. So we offloaded that to our robot. And then we have this meds to beds program, and that is patients that are going to be discharged, they can have their medications filled at our retail pharmacy. And the thought behind that is, if you go home with your medications, and, most likely, well, hopefully you would not be readmitted. And so we have Moxie doing those deliveries, because before it was a human doing that. We also have these discharge meals. This is more for our elderly patients. So when they're going to be discharged, make sure that they have a nutritious meal throughout the day. Moxie's also delivering those. As I said, radiology is actually, they use Moxie quite a bit. patient belongings moving around, because again, that's normally a person who does that work. Equipment, a person would normally do that work. Supplies, and then I know Nemours is typically on these calls, and we do a lot of newborn testing, like the tests. Oh, that should be, and then the chart's a separate one. But the newborn tests, they send them to the testing site, and then also chart delivery and pickup. And then we also have future use cases. So we do have a roadmap around this because this is a 3-year grant. And the biggest one is EHR integration. That has not been done yet, and we are pioneering this work with Cerner, that is our EHR vendor, and then also the robotics company. And so what we're working on is when orders go in, right now, orders go in, and then the nurse has to call and has to, find certain equipment, figure out there. And now when the order goes in, it automatically triggers, because we have 3 different supplies we want, it automatically triggers to that area, and it will trigger Moxie to go get it. And so that is, and then Moxie will bring it up. So the nurse doesn't have to do anything. Orders in, he or she doesn't even have to worry about it. And so that's what we're working towards. Also Vocera, that's like the handheld, I mean, it's a smartphone, but on there, they can actually ask for something right at the palm of their hand if they need something from Moxie. Right now, they have to walk to a kiosk that's at the front of the units. We do not have our lab use cases turned on yet, because with the door, because Moxie cannot push open a manual door. It needs to be automatic. And so we're working on getting an automatic door, and then we will turn on our lab use cases. Same with pathology. Christiana, we have a robust acute care nursing program, and these virtual nurses, they have a off-location command center. And so we want to get a kiosk there. So if there's something that, a nurse who's working in a virtual space is like, oh, a patient needs this, well, he or she can then go on the kiosk and ask for it, and then Moxie can be dispatched for it. And then we're also looking at, because Moxie services the whole hospital. And as you can imagine, some deliveries can take longer, especially if there's a lot to deliver. And so we're looking at, if we kind of have this kind of centralized supply room with a person in there, because Moxie cannot use that arm to like grab things. It's only for door opening. If we can have that, like maybe a more localized Moxie model, like taking one of them off and doing this more localized for delivering supplies, because then if a nurse needs it, then he or she could have it quite quickly. And then these kiosks, as I mentioned, they're iPads, and that's how you can request something. And they're at the front of the desk, but how the units are laid out, especially in our E-tower, they're a rectangle. So, if you're working in the back of the unit, you have to go all the way to the front of the unit to ask for something. So we just want to get some additional ones in there so nurses aren't, walking around more than they need to be. So those are some of the cases that we are looking at. And then the research and evaluation. I can tell you this is hard. This is really hard. So with the 3 years, when Moxie first came in, and robotics, for us is new, it's cutting edge, and really understanding what is the data, how do we share this, how is it actionable, how is it meaningful to us, what are we going to do with this? So it took some time to kind of sort that out. Also the data, we really wanted to work on the operations of it, because we're immediately implementing this robot, and we need to look at it operationally. And so we spent a lot of time just really focused on those operation pieces. And then I worked on the first research study, which I'll talk about in a minute on the right side. And then year 2, this is what we're in right now, year 2. So we are working on that EHR integration. Right now we're collecting pre-data before the integration is built, and Moxie is dispatching doing this work. And then right now I'm in the middle of building the second research study, which is going to be qualitative again, because we cannot link the data. It is robotics data, it's just a separate data, and we cannot, as of right now, we cannot link it to our data at Christiana. So it's it's really hard to study it. And then also the human decision making around using a robot, not using a robot, what drives all that, we can't link it quantitatively. When someone decides whatever their decision is, there's no way to capture that objectively. So so I have to focus, or I have to use focus group. Well, right now I'm using focus groups, and I have to live in the qualitative world, and I really like my quantitative world, but here I am. And then also we're always looking at the business use case. We're always looking at return on investment, really important. And then for year 3, which we will start late spring, early summer of this year, really looking at how we can impact nursing practice. We are building towards that, also looking at scalability, sustainability, really important. We're having these robots coming in because technology, robotics is going to be the way of the future. And we have to look how to, scale this, and then always looking at the business case ROI all the time. And then for the research study that I did, the first research study, it is now right now with just our internal review. And so I will be submitting it soon for publication, and it's titled Integrating Collaborative Robots in a Complex Hospital Setting. It's a qualitative descriptive design. And I picked this design because it's more about the breadth of knowledge versus depth. And, this is new, this is cutting edge. And, we want to build and inform future studies, but we need to have a good foundation around it because we don't understand it as well. And so I always say, well, we want to build a house on, a good, strong, wide foundation, not stilts. So it's breadth, not depth, this type of design. And essentially we have these robots in there, and we really need to see, like, how are they functioning within this environment? It's very complex. We have a 900-bed hospital at the Newark campus, and robots in general do best when it's predictable and it's a structured environment. In a human environment and a hospital environment, it's anything but that. So the work is very aspirational, but it's hard too. So our methods, we did observations and we did field notes. We did it over 6 hours, or 6 weeks, not 6 hours, 6 weeks. And then we had different shifts. And so we totaled about 33 hours. And we were there like all different days of the week: night shift, day shift, evening shift, weekends, weekdays. And then, as I said, around its breadth, not depth. So it's a qualitative content analysis level of interpretation. The major themes that came out, humanization of his cobots. On that first slide that I had, you can see that, they're cute looking, and they can wave, and they can do heart eyes, and they can meet, and they have these pleasant sounds. And so people actually talk to the Moxies like humans. They're always like, "Hi, Moxie, how are you? Oh, excuse me." Like, if she's coming around. So it was interesting watching them talk to her like a human. The usability of the cobots, very important. You got to be able to use these cobots, or, if they're not easy to use, people will not use them. Also, really important, as I mentioned, how these cobots function in this very dynamic, very complex environment. And then their autonomy too. These cobots still need human help, and autonomy is definitely a journey. And that was something that we were looking at, what we observed as well. And if you want to know any more about the research side, I do have my email at the end that we can, talk offline. And then, as I mentioned, sustainability, scalability, really, really important for these robots. And as I mentioned, we're always looking at use cases and, what could have implications for all different types of health systems. We're studying it at one type. We're big, we're complex. It's kind of like we went big or go home. So, but, maybe it could be different at smaller ones where there is not as much of a human runner infrastructure. And then also, I created a national Moxie user group. So I talked to all different directors all over the US who have the Moxies there. And we really exchange ideas and who's doing what and who's using what, or using her in a certain way, and how, and, maybe it's something we should be doing. And like for the other groups, because we have resources because of the grant funding, we are looking at that data very intensely, and other organizations are not. So like I just met with them on Tuesday, and I shared like different ways that we're looking at the data, and they were like, wow, and just give, some ideas of how they could possibly look at it, especially on the operations side. And then always, partnering with, industry, and in particular for this one is robotics industry, to really find those solutions, because robots, they started in the 1980s for surgery, and, now they're becoming delivery systems. So robots are definitely will be here to stay, and, just figuring out how, we can scale these different solutions. And then, as I mentioned, metrics are very hard. Things don't link. And so it's difficult because we're putting a robotic system in a human design system. And like hospitals aren't built for robots, they're built for humans, and they're designed by humans. So it's very difficult to look at those metrics and identify, what do we need to do? What are we trying to answer? What are we trying to measure? And then also value too. When we look at ROI right now, we have preliminary numbers around it, but, return on investment can be measured all different ways. It doesn't always have to be money. So we're looking at value in just different ways, and what does success mean in different ways. And then, anytime you bring new technology, we all know this, you bring a new technology, you need to have your end users on board around it. And so we're always partnering with our clinicians and any of our hospital staff that are, using the technology. How can we make it better? What are your pain points? And then we can take that back to the company. And then also just redesigning work environments. We want these cobots to be team members, to really think of them on your team. Like right now, like they service the whole hospital. So it doesn't quite have that team feel, but that's why we're looking at possibly having more of a localized one around like supplies, and someone can do, or it can do the supply running. And so that's something that we are looking at and thinking about as well. And then just the acknowledgements. As I said, this is grant funded. We're very appreciative to the ANF and then all our leadership, all staff that, use the cobots and, work very closely with OSP and research coordination, IRB, IT, Diligent Robotics. They're the ones who create the Moxies, Cerner, and LiftNet. We are integrating, we're trying to integrate with the elevator as well. And so we do work with them. And that's it.